We all will encounter a nurse in our lifetime, whether it is during our first bath after birth or holding our hand in our last breath. We are to learn something about the definition of a nurse. Some see a nurse as someone who works in a hospital and is willing to stick people with needles and insert things in not so comfortable places. Others may see them as lifesavers and good doers, but I see a nurse as a superhero, rescuing us from death. Now I would like to share with you what a nurse is by starting with where it began, and then describe the 8 roles that they acquire in this job title. When we go back to the origin of nursing, one woman comes to mind, and this is Florence Nightingale. She was the one that changed it all. However, nursing came about before then. Around the 1700s, hospitals were designed for dividing the ill from the healthy. Along with the creation of hospitals came caregivers referred to as nurses. Nursing blossomed as epidemics struck and wars were fought. Toward the end of the century, trainings were designed, and in the 1800s, nursing schools were birthed. Cited from Wellman, 2014. Nursing had a lot of issues with the performance of care until the influence of Florence Nightingale. Writers say she was the nurse before her time, implementing skills that had not yet been discovered in preventing disease and death, such as cleanliness and sanitation. After her effects in the Crimean War in 1856, she wrote books and taught, emphasizing her focus on the environmental aspects of nursing. Cited from Kowalik, 2009. Thereafter, nursing flourished to what it is today, with many other nurses and their theoristic impacts, helping define what it means to be a nurse. Nursing is different for each individual, based on their personality and passions. However, all share 8 roles and functions that make up this term nurse. Number 1, a nurse is a caregiver, one who is focusing on the patient to regain their health through restoration of physical, emotional, spiritual, and social well-being. It's time for your sponge bath. Number 2, they are clinical decision makers, using clinical thinking skills to decide on the best approach for their individual. This medication can't be given to this patient. Third, nurse is the protector / advocate, maintaining a safe environment and preventing injury, along with protecting legal rights of the patient in situations. Fourth, they are case managers, coordinating members of the healthcare team to interact in clients' care. Hey, nutritionist, give my patient as much ice cream as they want. Number 5, a nurse is a rehabilitator, helping to adapt fully as possible to a patient's life-changing event. This is how we will need to walk now. Number 6, nurses are comforters. Gives physical comfort along with emotional support. They're there now. You will get better. 7, communicator. This is the central to all nursing roles, communicating with all personnel involved with an individual's care. Hey, I'm the nurse. Everyone listen up. Finally, number 8, teacher. The nurse educates and demonstrates patients to learn how to adapt and prevent and be informed to changes in their body and life. If you continue smoking, your lungs are at risk for cancer. Cited from Roles and Functions of the Nurse, 2001. As you see, nurses have a huge responsibility for every patient's care, and life would be almost impossible with these life-changing figures. Conclusion. These lifesavers play a simple role, such as helping one brush their teeth, to crucial roles, such as doing compressions to bring a heart back to life. We are all bound to encounter a nurse in our lifetime. Nursing wasn't too beneficial in the beginning, but after the theorists like Florence Nightingale and the incredible nurses that make up the history of the medical field, we are blessed to have someone to play these roles in our life. when we are in need of a superhero. Now, the next time we encounter a nurse, we will think of the 8 roles they play and the following phrases: helper, encourager, comforter, teacher, and friend.